Hello everyone, and welcome. Today, we're going to talk about a specific type of eye injury called traumatic iridodialysis. It might sound complicated, but we'll break it down into simple terms to understand what it is, how it happens, and what it means for your vision. First, let's define it. Traumatic iridodialysis is a condition where the iris, which is the colored part of your eye that controls the size of your pupil, separates from its root. The iris normally attaches to a structure called the ciliary body, which is located just behind it. When this attachment tears away, it creates a gap at the edge of the iris. The irido part refers to the iris, and dialysis means separation, so it literally means iris separation. The traumatic part is crucial because it tells us the cause. This separation happens due to a direct injury or blunt force trauma to the eye. Think of impacts from a fist, a ball, or even an airbag in a car accident. When a strong force hits the eye, it can cause a sudden change in pressure inside the eyeball, and this pressure wave can be strong enough to rip the delicate iris tissue away from its base. This can leave a visible D-shaped pupil or an extra opening at the edge of the iris, allowing light to enter the eye not just through the main pupil, but also through this new gap. Now, let's discuss what symptoms someone might experience with traumatic iridodialysis. Because light can enter the eye from an abnormal angle, people often report seeing double images, a condition known as monocular diplopia, meaning double vision in one eye. They might also have significant glare and increased sensitivity to light, called photophobia, as more uncontrolled light hits the retina. Vision can become blurry, and there might be initial pain, redness, and even bleeding inside the eye, which is called a hyphema. In some cases, if the tear is large, it can affect the eye's ability to drain fluid properly, potentially leading to increased eye pressure, a condition known as glaucoma. Diagnosing traumatic iridodialysis usually involves a thorough eye examination by an eye doctor, often including dilating the pupil to get a clear view of the iris and the angle where it attaches. Sometimes, a special lens called a gonioscopy lens is used to examine the angle more closely. Treatment depends on the severity of the tear and the symptoms experienced. For very small tears that don't cause significant visual problems, observation might be sufficient, and symptoms like glare can be managed with dark glasses or special contact lenses that block the extra light. However, for larger tears, or if the symptoms are significantly affecting vision and quality of life, surgical intervention may be necessary. Surgery aims to reattach the iris to its original position or to repair the pupil, helping to restore normal light control and improve vision. This procedure can be quite delicate and is performed by an eye surgeon. Thank you for watching and learning about traumatic iridodialysis with us today. We hope this explanation was clear and helpful. If you found this video informative, please consider giving it a thumbs up, sharing it with anyone who might benefit, and subscribing to our channel for more content like this. Your support helps us create more educational videos. We appreciate you being here.